Measles is a highly contagious upper respiratory infection that is caused by a virus. It is transmitted person to person. It can be quite serious, particularly in those people who are unvaccinated or who have other medical conditions, such as immune-compromised status. This disease, while it was first described in the 9th century, was not identified as an actual virus until 1954. Humans are the only known host of this virus. Measles is highly contagious and is spread through the air when an infected person coughs, sneezes, or talks. The virus can also live on surfaces for up to 2 hours. Anyone who is not protected against measles has a 90% chance of becoming infected just by being in the same room as a person with measles, or by touching a contaminated surface and then touching their eyes, nose, or mouth. Symptoms usually begin 7 to 14 days after an exposure with measles. Early symptoms, which are usually within the first few days, typically include a moderate fever, cough, runny nose, also known as coryza, and red, watery eyes, also known as conjunctivitis, and a sore throat. Later symptoms can include these distinctive blue-white spots inside of the mouth, known as Koplik spots, and the characteristic red-brown rash that begins at the hairline and spreads down the body. Fevers can be as high as 104 degrees Fahrenheit. The rash usually appears 14 days after an exposure. However, in those folks who may be immune compromised, no rash may appear. Children and adults may have very common complications such as ear infections, pneumonia, bronchitis, or even diarrhea. However, there are more serious complications such as encephalitis, respiratory failure, miscarriage, stillbirth, premature birth, and there is a well-known fatal degenerative disease of the central nervous system. Some of these presentations may even occur up to years after the infection with measles. The people who are at the highest risk for complications include infants and children under the age of 5, adults over the age of 20, pregnant women, and those people who may have an immune-compromised status, such as those undergoing chemotherapy or who may be afflicted with HIV. The measles vaccine is the single most effective way of preventing infection. This vaccine, which was originally developed in 1963 and changed in 1968, has been the only measles vaccine used in the United States since its introduction. Most children will be vaccinated with the measles, mumps, rubella vaccine, or measles, mumps, rubella, and varicella vaccine at ages 12 months, and again with a second dose at age 4 years. A single dose of the measles vaccine is 93% effective, and the efficacy increases to 97% following the 2-dose series. Following vaccination, most people are usually fully protected within 2 to 3 weeks. The vaccine is so effective, in fact, that in the year 2000, measles was declared eliminated from the United States. Still, there are outbreaks every year in the US, mostly due to international travel. Most cases of the measles virus in the United States have been among people who are unvaccinated or who have other medical conditions. The Texas Department of State Health Services offers several low-cost programs for vaccination, including Texas Vaccines for Children and the Adult Safety Net program. CommuniCare health centers are a part of both programs. Additionally, pharmacists can vaccinate children aged 13 and under only with a prescription from their medical provider. People 14 and over may be vaccinated by a pharmacist without a prescription. Boosters or additional doses may be given, but these are under special circumstances and are best determined by your healthcare provider. If you are concerned you may be experiencing measles symptoms or have a confirmed exposure, it is recommended that you contact your healthcare provider as soon as possible. We do ask you to please call the provider's office first before coming to the clinic. This is so that you may receive instructions for a safe and efficient visit. Not only is this for your own safety, but for the safety of other patients and the healthcare team who is providing your care. As always, your medical provider is the best source of information regarding this and any other health concern that you may have.